Welcome to another episode of PharmD&ME. Today we're going to talk about thyroid and the thyroid disorders. First thing we should talk about when we're talking about the thyroid is the physiology. So we'll start with the hypothalamus, which will release thyrotropin releasing hormone, which will stimulate the pituitary to release thyroid stimulating hormone, which will stimulate the thyroid to release T4 and T3. And these will affect our target organs. They control the rate and use of energy and protein synthesis. The T4 and T3 will work as a negative feedback loop on the pituitary and hypothalamus. All right, the first disease state we're going to talk about is hypothyroidism. There can be several causes of this, but one of the main ones is Hashimoto's thyroiditis, which is an autoimmune disease. So to diagnose hypothyroidism, we're going to look at a blood test, and they test for TSH, and you're looking for levels of above 10 milli-international units per liter, and we'll also test for antithyroid antibodies. The treatment for hypothyroidism is to simply replace the thyroid hormone that is not being produced. So we'll do this usually through levothyroxine. We'll start low and titrate to desired TSH levels. We'll check levels every 4 to 6 weeks, and then once stable every 6 to 12 months. You'll take on an empty stomach, usually first thing in the morning, 30 minutes before meals, and 2 hours before or 6 hours after taking binding agents such as antacids or iron. Some other options that you could take would be beta blockers like propranolol, and you would use this adjunctively for symptoms in an emergency, in a thyroid emergency. All right, the next disease state that we're going to talk about is hyperthyroidism. Some causes of this can be Graves' disease, which is autoimmune, toxic nodular goiter, tumors, or it can be drug-induced. To diagnose hyperthyroidism, we're actually going to look for decreased TSH levels, which would be less than 0.1 milli-international units per liter, and increased T3 and T4. All right, to treat hyperthyroidism, there's pharmacologic agents, surgery, and radioactive iodine. Today we'll focus on the pharmacologic treatment, which will include your thionamides, which will be methimazole and propylthiouracil. These block the formation of T3 and T4. The side effects include GI and arthralgia. And the goal is remission, however, relapse are very frequent. And so this concludes our review of thyroid and thyroid disorders.